President Trump. He's trying to act as though the pandemic is behind us when it's actually on the rise right now. Let's go to our chief White House correspondent, Jim Acosta. Jim, you have new information on the president's refusal over these few months to even wear a mask.
That's right, Wolf. President Trump is on his way back from the battleground state of Wisconsin, where he was trying to rescue his re-election chances as the economy is reeling from the coronavirus pandemic. And we are learning tonight that the president is walling himself off from bad polling, telling advisors he does not believe the latest polls showing he is trailing Joe Biden. And the president is pushing off public health experts. Aides are not hopeful the president will ever warm up to wearing masks, we are told, as one official told us, quote, the president will never change on the mask. With coronavirus cases spiking and his poll numbers tanking, President Trump is chalking up the pandemic surge in the U.S. to increased COVID-19 testing and nothing more, tweeting, the number of cases goes up because of great testing, while the number of deaths, mortality rate goes way down. But the president is signaling the number of dead could continue to soar by the tens of thousands.
Could have been stopped in China, but we could have lost anywhere from 2 to 4 million people, as opposed to where it is now, which is probably 115, but it could get, a little bit higher than that.
But is it right
it could get up to 150, it could go beyond that.
That's roughly 100,000 more deaths than what Mr. Trump predicted in April.
Now, we're going toward 50, I'm hearing, or 60,000 people. One is too many. I always say it. One is too many. But we're going toward 50 or 60,000 people.
The president is still bristling at questions over wearing masks.
How do you try that, especially?
Why aren't you further away, and why aren't you wearing a mask?
I can take a step back.
No, but you're way. I mean, you're not social distancing based on the question.
But hold on. In Ohio, Vice President Mike Pence was wearing a mask. In Texas, where GOP Governor Greg Abbott is pausing his state's reopening, he said in a statement, I ask all Texans to do their part to slow the spread of COVID-19 by wearing a mask, washing their hands regularly, and socially distancing from others. In Florida, Republican Senator Marco Rubio is recommending masks too.
Masks work. They reduce infections by up to 50%. It's not a big deal.
Ever since the president's disappointing weekend rally in Tulsa, where thousands of empty seats were on display, dozens of Secret Service agents have now been forced into quarantine, as that agency is now asking its teams on presidential trips to undergo COVID-19 testing. That's in addition to the Trump campaign staffers testing positive and now in quarantine as well. With 1.5 million new initial unemployment claims filed last week and more than 47 million since mid-March, the president is now trailing Joe Biden in critical states like Wisconsin, where a new poll finds the former vice president with a strong lead.
He's like a child who can't believe this has happened to him. All his whining and self-pity. Well, this pandemic didn't happen to him. It happened to all of us. And his job isn't to whine about it. His job is to do something about it.
The president is banking on distractions to bail him out, like the protesters threatening to tear down statues across the U.S., as Mr. Trump is deploying U.S. Marshals to protect these historic sites.
They're looking at George Washington. They're looking at Abraham Lincoln, Thomas Jefferson. Not going to happen. Not going to happen. Not as long as I'm here.
Ex-aides like former National Security Advisor John Bolton say the president simply hasn't focused enough on the virus.
And he didn't want to hear about the potential impact of a pandemic on the American economy and its effect on his reelection, turning a blind eye to all these early signs.
Now, as for the coronavirus task force, officials have noted to us that the president has not spoken with Dr. Anthony Fauci in 3 weeks, and Dr. Deborah Birx has all but vanished from the spotlight. Advisors and allies have urged the president to moderate his tone on the virus, but we were told he just won't do it, and some advisors worry the president has simply become too stubborn to change course on the virus in time for the election. As one advisor put it to us, the Tulsa rally proved the president is, quote, mortal. Wolf?
Jim Acosta at the White House, thanks very much. Let's bring in our chief medical correspondent, Dr. Sanjay Gupta, along with Dr. Christopher Murray. He's the director of the Institute for Health Metrics and Evaluation at the University of Washington. Sanjay, you just heard Jim Acosta report a White House official is saying the president will never change on the issue of the mask, not because he doubts their importance, but because he simply doesn't want that image. You've said you can't believe our country is in this position right now, and you thought originally that by the end of June, we'd have much more to actually celebrate. Do you think with more cohesive leadership, a willingness to listen to health officials, much of this devastation could have been avoided?
Absolutely. Wolf, no question. I don't think anyone should look at this situation and say this was inevitable. This is the way that it had to be. I mean, there were definitely things that we could have done. We could have acted earlier. We could have implemented more testing. We could do the things that Jim Acosta is talking about in his piece. I mean, the idea that the president's picking style over substance in the middle of a pandemic with regard to masks, it's absolutely ridiculous and preposterous when you look at what's happening in the country. There's plenty of evidence, as Dr. Murray will say, about how well masks can work, and we've seen evidence of that around the world. Places where they use masks regularly, even places where they didn't go into lockdown, have had this pandemic significantly under better control. So this was not inevitable, Wolf, to your question.
Yeah, it certainly wasn't. And Dr. Murray, your respected model now projects some 30,000 American lives could be spared by October if nearly all Americans would simply start wearing masks. First of all, tell us, how did you determine that number?
So we've looked at all the published studies on how masks work for individuals, and each individual who's wearing a cloth mask when they're out in near somebody else gets about a third or even as high as a half reduction in transmission. But when you translate that into what it means for American lives at the community level, that reduction in transmission can save 33,000 lives by October 1st. And if we go farther, later in the year when we expect even more coronavirus around, it could save even more.
Yeah, you project if no changes occur, 179,000 Americans will die from coronavirus. If 95% of the American public starts wearing masks when they're out in public, indoor or outdoor, 146,000 Americans will die by October 1st. Right now, more than 122,000 Americans have died. Sanjay, the CDC is also now saying that the coronavirus infection rate here in the United States is likely 10 times higher than we know. Is this due to a high rate of asymptomatic carriers, a lack of testing, something else, or something else entirely?
No, I think it's a combination of those things. I mean, it's been really hard to get tested in this country unless you had some symptoms up until recently. So now we're seeing, people who don't have symptoms being able to get tested. That particular study also looked at antibody tests. Those are the types of tests that will tell you if you've been previously infected. So I think that that's where they're arriving at this number. And, frankly, Wolf, it doesn't surprise me. I mean, the virus has been spreading. It's a very contagious virus. And if you do the math as well, Wolf, if you look at the right side of the screen and do the math, the number of deaths over the number of total cases, that would suggest about a 5% mortality rate. 5%. I think that in most places around the world, the estimate is that it's a lot lower than that. So if in fact the number is 10 times higher, the number of infections in this country, the mortality rate would be closer to 0.5%, which would make sense, Wolf. But the reason that there's this prediction of so many more people infected is because the virus has been spreading, unchecked in some places for quite some time.
Well, Dr. Murray, do you accept that estimate from the CDC now? That right now the confirmed number, 2.5 million confirmed cases of coronavirus in the United States, but it's really 10 times higher. 25 million Americans may have had it. Many of them, of course, totally asymptomatic.
Well, absolutely, there's going to be at least 5 times as many people who've been infected as the cases we've detected. And if you look at the numbers, for example, in New York of deaths compared to the antibody testing there, that's sort of where you land. If it's as high as 10, it's possible. And I think it's going to be in that range, 5 to 10 is what we think.
Dr. Murray, why is it so important to have accurate data about this infection rate of this very, very deadly virus?
Well, it's super important for 2 reasons, Wolf, which is first, are we detecting all the deaths that are out there? And, we've had all these issues about deaths that have gone undetected in nursing homes and in homeless shelters and elsewhere. And this might be a marker in some states where that ratio looks different, if there's more infections out there than we expected. And then the other issue is just managing the epidemic. If we don't succeed in getting it under control later in the winter, in which places, immunity actually starts to get up to, 40 or 50% if we actually get to that space.
Yeah.